To the day's other news, thousands of senior doctors around the country went on strike for 24 hours at midnight over their stalled pay dispute. Health New Zealand says more than 4,000 procedures had to be postponed as a result of today's action. But the Doctors' Union says that figure pales against the number of procedures that have to be delayed every day as a result of chronic staff shortages. Adam Hollingworth reports.
It's the first time senior doctors have been on a 24-hour strike. They walked off the job at midnight. Some clinics are closed, but hospitals and EDs remain open today. The doctors say they've been offered 1.5%. That's below inflation. They're demanding 12% plus an increase to cover the rising costs of medical education. Health New Zealand, Te Whatu Ora, says there's no spare cash.
Oh, look, there's no more money in our coffers. We've as I say, we've sort of put our best foot forward. It's clearly not enough.
They say the offers amount to increases of between $8,000 and $29,000 on a senior doctor's base salary.
Most of us don't have to train for 15 to 20 years in order to do the job that we're currently in. We don't make life and death decisions, most of us, on a daily basis.
Health New Zealand put a credible offer on the table. Unfortunately, the union decided not to put that to its members. They should have. Instead, they decided to continue with the strike, which is causing disruption of care to patients.
The unions say they are also in an international marketplace, and senior doctors earn much more in Australia than they do here. This strike is as much about pay as it is about the shortfall of senior medical officers. The doctors here say that's around 25% around the country, but is as bad as 45% in places like Gisborne. Health New Zealand says that figure is closer to 10% across the country.
This means that the remaining senior doctors are having to be the glue holding together a broken health system. They're having to desperately try to provide increasing levels of patient demand and need.
Recruiting doctors is tough, and it's a competitive market. But I think people come to work for more than just money. I think people come to work for the value of the service they do, the people they work for.
Health New Zealand estimates 4,300 planned procedures will have to be postponed due to the strike.
There are too many New Zealanders already waiting too long, and what happened today is not going to assist with the challenges of getting on top of those wait lists.
I want to apologise to patients who are inconvenienced, but I think we need to keep that number in proportion to the many, many thousands. I think we're somewhere in the 80,000 people awaiting surgical procedures who are just waiting one day more.
In the latest development, there'll be what's called a facilitation case conference tomorrow. The Employment Relations Authority will talk to both sides about the next steps to take.